Well, first, let's get you today's figures. And India reported a single-day spike of 96,982 infections, a day after it breached that 1 lakh mark in daily cases. There have also been 446 deaths in this very same period. Now, the big news that has been announced today is that there will be night curfew in Delhi from 10 p.m. to 5 a.m. Already, there is night curfew in place in Maharashtra from 8 p.m. to 7 a.m. And this, as we mentioned, we are in the midst of a second wave of coronavirus. If we talk about the vaccines, then over 8 crore vaccine doses have been administered in the country so far. The highest daily vaccinations took place yesterday, with 43 lakh vaccinations taking place on a single day. 89.6% of healthcare workers have received their first dose, and 48.6% of frontline workers have got their first dose of the vaccine. Well, to talk more about the situation the country now finds itself in, given the rising numbers and, of course, the vaccine drive and the new measures that are being announced by various states, the national capital announcing a night curfew, we're now joined by Dr. Naresh Trehan, Chairman and Managing Director of Medanta Medicity. Thank you so much, sir, for joining us again. And you've been with us since the start of this pandemic. And, you know, it's been over a year on, and we find ourselves in the midst of the second wave of coronavirus. First and foremost, Delhi announcing a night curfew. Mumbai and Maharashtra had already announced a night curfew. How effective are these in fighting the spread of the disease?
Well, you know, they are not very effective in the sense that it does affect that people who were attending nightlife events like bars or any other social events and all that, that kind of curtails that. But it's not very effective because the main activity is during the day, and from 10 p.m. to 5 a.m. really, I don't know how effective it will be. Anyway, so the point is, this is just a measure, but maybe there may be more required as we go forward. So I think that as you can hear from me, it's very uncertain that it's going to have major effect.
All right, so one of the ways that perhaps it would is what you were talking about. People, are getting really fatigued with all the restrictions, and they've been going out. There's been a lot of, gatherings taking place, weddings taking place. Perhaps this will bring that sense of urgency back to people. The fact that we are in the midst of this second wave, so much so that the Delhi government now, implementing this night curfew.
Well, okay. So it's like a preamble to saying that if it still doesn't come under control, we may have to do other things. Okay. Now the whole thing is that yes, what are the events that are causing all this? So there are basically not in Delhi, but in other states, the elections, the religious events that are happening. In Delhi, mainly gatherings in weddings when we allowed. I've seen 300, 400 people, 500 people in a wedding. I mean, why should that be allowed at all? Today, we are facing a very grim situation. We have exceeded 1 lakh and more. And if we do not respond responsibly, every citizen doesn't respond responsibly, we'll all pay for it. It's not that the ones who are violating will not pay. We see in the hospital people who attended a wedding, 10 people, 12 people from that wedding have come here. So it is spreading. The R factor, it looks like, of the second wave is higher than what it was before, maybe twice. And the rapidity which it is spreading should alarm every citizen. Let me tell you, no matter how old you are, and the older you are, the more grim it becomes for you. But even if you're young, you will see hundreds of people, thousands of people who were below the age of 30, 40 who got it, are still suffering months later. So it's not a pleasure to get this disease. At all costs, we should try to avoid it. No matter what your age is, no matter how robust you are, how strong you think you are, these are all misconceptions. Of course, God forbid the older people get it, then it becomes life-threatening also for them. So
Right.
For everybody's sake, just restrain yourself. Think you are in curfew and only do essential activities.
Absolutely, Doctor, and that's, what we've been telling everybody from these shows that we've been doing here on NDTV. But, the curve of this particular wave is even steeper than it was the first time around. And so what is really causing the second wave? One, of course, that we've spoken about is how people have become very careless, and the government also at some level, there's been this mixed messaging in terms of, on one hand, telling us to all be careful, practice protocols, but then the massive rallies that we're all seeing on our screens, and as you said, religious events, the Kumbh taking place in Haridwar. But really, what is behind this second wave?
So there are two factors. One, of course, we all knew that there is fatigue brewing. The COVID fatigue was in everybody's mind. A year is not a short time. When people saw that the numbers were declining, and they felt a sense of security, that now it's not so bad, so maybe I can venture out there. But venture out there is one factor only. And like you said, the other events, of course, contribute. And then there is free travel between states. So if it's happening in one state, does not mean it's not going to be exported into the other state. So the fact is that all these things that are already a relief to society in a way, that you can go shopping, you can do this, you can do some weddings and stuff like that, is not to be misunderstood today. If it happened in the past, I can understand. People went out there and they sort of threw caution to the wind. But when the data is showing us staring us in the face on a daily basis, the extent to which this is spreading is phenomenal. We must understand that. We must understand the dangers. But you asked me this question, why is it spreading so fast? If you study the Spanish flu, the second wave of the Spanish flu was also much more infective, but not as lethal as the first wave. It looks like today that what we are experiencing as the second wave is following a similar pattern. The R factor is higher. The speed with which it is spreading is much faster. But at the same time, it seems like that the degree of illness is less. So there are two factors for that also. One is people who have already been infected before, some of them are getting reinfected if their antibodies and all that immunity was down again. And that they are experiencing a very mild form of reinfection. Secondly, the ones who have been vaccinated, even after the first dose, between the first two doses, when people get it infected in between, say, who have developed some antibodies, they are experiencing a milder form of disease. The ones who have been fully vaccinated, and there will be 4, 5, 6% of those people also who will still get it, and they are getting even a milder form. So the point is that the benefit of the vaccine is absolutely obvious. Many people have developed antibodies already, whether they knew that they got COVID or not, but in the zero surveys, it's quite clear that significant number of people have gotten it. Now, our challenge is twofold only. Mark time by absolute strict adherence to COVID responsible behavior. If every individual can get it into their mind that this is what I can do to save myself, my family, my community, and my country, that would be the first step. And that will be the most effective step, by the way.
Right.
The second is we must vaccinate as fast as we can. And there is some limitations of the availability of vaccine doses, but we are hoping that in the very near future, we'll have at least 10, 11 crore vaccine doses a month. Once we reach that, you can see that in the next 3 months, 4 months, we can actually cover that 30 crore, 40 crore people who we wanted to cover. And that will take us quite significantly towards herd immunity.
All right, so now the chief ministers of Maharashtra and Delhi have both written to the Prime Minister asking, for changes in the people who can get vaccine, while Delhi Chief Minister has asked that there should be no age limit, and he says we'll vaccinate the whole of Delhi. Maharashtra has asked for the age to be lowered. Your view on that?
See, when you have a limited supply, what is the moral responsibility of the government and the medical profession? The moral responsibilities go to the vulnerable first. because the consequences of the vulnerable getting the infection is much higher than the ones who are not so vulnerable. So that the technique or the methodology that the government adopted, and governments around the world have adopted it. It's not that only the Indian government did it. The Indian government did a good job. That you go by the most vulnerable and the next less vulnerable and the next less vulnerable and then open it for everybody. So like I said earlier, if we can get access to those doses that we need, and like I said, the two manufacturers today are promising that they will ramp up. Today they are giving 7 crores a month. It's not enough. Sputnik, we believe, will be approved because their data is looking, in unofficial, is looking quite good. So hopefully they will get approved in the next week or so, a few days. If that happens, then suddenly we'll get about 11 crore doses, and the other manufacturers are also saying that we will ramp it up. So if that happens, I think we can get relief much faster than we would otherwise. But in spite of that, this COVID behavior will have to be continued for 6-8 months, a year still. So your mask is your best friend. Don't throw it away. You are going to live with it. It's not such a big deal. It is essential. So, and I must compliment the media. Media has given enough time for all the experts and the doctors and everybody to come and urge the population.
We definitely have, and hopefully people will listen to this. And Dr. Trehan, as we're seeing hospitals getting filled up again, this time around, it's very different from last year, isn't it? Because now, the healthcare industry is much better placed to deal with the COVID cases.
Yes, true. I mean, we've learned a lot. A lot of methodology has emerged, which makes it possible for us to treat patients much more effectively, make it much safer and timely. Most important thing is that we know the full chain of when to do what. So that has led to the fact that the mortality is extremely low and the number of people who are going on ventilators is extremely low, and the numbers of going into the ICU are also low. So there is a great satisfaction, but it still doesn't take away the misery of the disease, by the way.
Yes, well, thank you so much.
Gargi, you're a COVID champion, so keep at it. I know you're there 24/7 doing the same thing, and hopefully at least a few people will listen to us.
Absolutely. Thank you so much, Doctor. And yes, you've been with us throughout this, 1-year-long journey that we've been covering this disease and learning so much about it and how to deal with it. Thank you so much for speaking to us.
Sure. Thank you. Thank you.
So let's now take a look at the vaccination drive. As Dr. Trehan was saying, we really need to ramp up those vaccination numbers. And let's take a look at India's numbers and how they compare to other countries. And we're also going to focus a bit on Kerala and how the state is faring. Now, Kerala is out of the top 5 most affected states. If we take a look at the vaccines, India has vaccinated over 8 crore people so far. They've received at least 1 dose of the vaccine, and that's equivalent of Germany's population. In fact, yesterday was the highest vaccination numbers, with 43 lakh people being vaccinated in a single day. But if we compare our numbers with other countries and the proportion of the population, that's where the worry comes in. So to talk more about this, we're joined by Rijo M. John, adjunct professor, Rajagiri College of Social Sciences, Kochi, and someone who's been really studying those numbers very, very closely, isn't it? If you could, explain to our viewers why on the one hand, while on the one hand we've managed to vaccinate such a huge number of people, 8.3 crore, why it's still a worry when we compare it to, the entire population, and why and how we've seen other countries have vaccinated a far greater number of their population as compared to us.
Hi, Gargi. Yes, we are absolute. I mean, the cumulative number of vaccinations, if you look at, 8 crores plus, but we should see that it has come in about 78 to 79 days. So the average, when you look at, India is such a large population. So 3 to 4 million doses per day is, though it looks absolutely gigantic in proportion, but, as a proportion of the population, it becomes really low. So we still have, almost 80 days into the vaccination, we still haven't reached 5% of the population with at least 1 dose each. And that means, we are running far behind the targets that the government itself set a long back, which said that, 300 million beneficiaries will be vaccinated by July, August, which means around 600 million doses. At the present rate, there was a time like 2 weeks back when we had our daily vaccination had gone up to 2.5 million per day on average. But it has now been coming down a little bit, except, of course, for the last 2-3 days, it has started picking up again. But we are still on an average for the last 7 days. If you look at, we are still around 2 million figure on average per day. And that's highly insufficient.
And this is after opening it up to everyone over 45 years old.
And when you actually...
Because earlier they were planning to vaccinate just all the elderly and those with severe illnesses who are above 45 till the summer, and that was that 30 crore number that they were hoping to get, and now they've opened it up, and still vaccine hesitancy is being seen as a big issue. And we really need, what do you need to change in terms of our vaccine drive to really go out there and cross 55 million per day or 50 lakh per day?
So I think one of the major worries have been on the glitches associated with the CoWIN app. When you go into the rural areas, there is internet connectivity issues and stuff like that, which sort of limits people's ability to properly sign up and upload your photo IDs, etc., into the app and then get an appointment, etc. So these kind of difficulties exist, and we should, on the one hand, while using apps like COVID to facilitate this drive, we should also not completely give away or give up the traditional methods, people being able to walk into the clinics and, your PHC or places where you get the vaccine, you can just do walk-in and, they register in a CoWIN app or some other portal later on after the vaccination is completed, So those kind of facilitations should be done. That is a need. And also, the vaccine hesitancy is real. We can't deny that. So what is to be done is to basically, encourage a sort of a bottom-up approach, wherein local healthcare workers, for example, can go to people and sort of encourage them to come for vaccination. ASHA workers, for example, they can literally encourage local people to come to the vaccination center and encourage those activities. So these kind of
that
major
is the need of the hour, for them to be able to talk people through any doubts that they have. Let's talk about Kerala now, and Kerala is no longer in the top 5 states, and we've seen that the numbers there seem to be, we don't want to speak too soon, but seem to be steady right now, just, over 2,500 around that average cases. If you could tell us a bit about the situation there.
Well, I wouldn't call it even steady now in Kerala, because in fact, Kerala has been on a declining trend for the last two months plus daily cases. But unfortunately, from March 15th till March 15th, this has been on a continuous decline, and we had brought down the test positivity rate below 3 to 3.5% level. But from March 15th onwards, if you look at the daily numbers, there has been a continuous increase now. It is right now about 2,500. So we had gone down to 1,800 on average, and now it has moved up to 2.5%. And even the test positivity rate in Kerala has now gone up from a bottom of 3.6% to over 5% right now. And what is unfortunate is also the fact that there has been a fall in daily testing also during this time, the last 2 weeks, which is really not a good sign. So, and that the election is happening in Kerala, and, there has been a lot of increased mobility, etc. happening. And so I wouldn't be surprised increased cases in coming days in Kerala. And I believe that it is high time the state government should significantly increase the daily testing for COVID-19.
Well, today the elections are over, so hopefully the government will get back focusing on this. Thank you so much, John, for joining us on the show and discussing all these issues regarding the numbers and vaccination drives and, of course, the situation there in Kerala.